In a bit, we'll focus on how health insurance affects the demand for health care and ultimately healthcare prices, utilization, and expenditures. First, we need to consider how patients or consumers actually respond to changes in prices or the price elasticity of demand. Price elasticity refers to the responsiveness of quantity demanded to a change in price. And this is a technical measure of price sensitivity, or the extent to which a consumer's demand is affected by a price increase or decrease. So following the law of demand, which stipulates that there's a negative relationship between price and quantity demanded, the price elasticity of demand is typically negative. And for that reason, estimates or calculations of the price elasticity of demand are often, but not always, reported in absolute value. So in essence, dropping the negative side. This helps us compare the magnitudes of the responsiveness of consumers and producers by the changes in prices or the price elasticity of demand and the price of elasticity of supply. So here's the formula for the price elasticity of demand and whether we define demand as being price elastic, price unit elastic, or price inelastic. So the price elasticity of demand, or epsilon D, is the percentage change in quantity demanded where that delta triangle symbol represents change in a given percentage change in price. It's the idea that if we have a given price change, depending on whether we have a much greater change in quantity demanded or a much smaller change in quantity demanded. That is essentially the measure of consumer responsiveness to price change. So if the top is greater than the bottom in absolute value, the demand is price elastic. We have a 10% increase in price. We might have a 20% decline in quantity demanded, and that means that in absolute value, the top is going to be greater than the bottom. That ratio will be greater than 1, and we say that the consumers are quite sensitive or responsive to change in prices. Conversely, we have that same 10% increase in price, but only a 4 or 5% decline in quantity demanded and absolute value. The bottom is greater than the top, so that whole ratio is less than 1. And we say that consumers are not very responsive to a change in price, or that demand is price inelastic. Now, if we have a 1-for-1 or unitary relationship between the percentage change in price and percentage change in quantity demanded and absolute value, then we say the demand is price unit elastic. That 10% increase in price leads to a 10% decrease in quantity demanded. The ratio in absolute value is equal to 1. Let's consider an example of this. Suppose the price of a train ticket from Philadelphia to New York increases by 10%, and the quantity of tickets sold decreases by 20% as a result. So what would the price elasticity demand for this train ticket? So if the price of this train ticket increases by 10% and the quantity of tickets sold, that is, the quantity demanded, decreases by 20% as a result. In this case, the price elasticity of demand, as we'll see in absolute value, will be equal to 2. So in this case, the percentage change in quantity demanded is minus 20. The percentage change in price is positive 10, and that means that the ratio is equal to a minus 2. So in this case, the demand for that train ticket is fairly price elastic, and that's because in absolute value, it's equal to 2, which is greater than 1. And this means that buyers are fairly responsive to the price of this train ticket. So whenever that ratio is greater than 1, that means that the percentage change in quantity demanded is greater than the percentage change in price in absolute value, and the consumers are fairly responsive to or sensitive to a price change. Now, why might that be the case for the price of this train ticket? Well, it could be because there are fairly decent substitutes available for the consumers, like taking a bus or driving into the city or simply traveling to New York City at another time. And generally, demand is more price elastic for goods and services that have many good substitutes or that are considered to be luxuries on the part of the consumer. Demand is less price elastic for goods and services that have few, if any, substitutes, or that consumers consider to be necessities, which is especially important in the healthcare sector. Now let's consider the relationship between price, total revenue, and the price elasticity of demand. So how would raising or lowering the price of a product affect the number of units sold? And how would such a price increase or decrease affect total revenue or total expenditure on the part of patients or their insurance? As we'll see, this will depend critically on the price elasticity of demand, where that measure of responsiveness of consumers to changes in prices. Recall the total revenue is given by the price per unit P multiplied by the quantity of units sold Q, or simply stated P times Q. So we can figure out how a price increase affects total revenue by breaking down this formula into the P component and the Q component. And so by itself, an increase in price will lead to an increase in total revenue. But we know from the law of demand that if you increase price, you also reduce quantity demanded, and that also has to be taken into consideration. By the way, a neat math trick, we can disaggregate this percentage change in total revenue into the percentage change in price plus the percentage change in quantity demanded. So this goes from the formula P times Q, giving us total revenue, to this new formula, which states that the percentage change in total revenue is approximately equal to the percentage change in price plus the percentage change in quantity demanded. So in this case, we have a 6% increase in price, and we note that demand is price inelastic. That percentage change in quantity demanded should be much smaller in absolute value than the percentage change in price. In this case, if price increases 6%, perhaps the quantity demanded will fall by 3%. And that means that approximately total revenue will rise by 3%. That's the case when demand is price inelastic. That's where a price increase leads to an increase in total revenue or also total expenditure. And that we can go back to the formula for elasticity percentage change in quantity demanded given a percentage change in price. Here, the top is -3. The bottom is +6. So the price elasticity of demand is equal to 0.5, which in absolute value is 0.5 or less than 1. Now let's consider all possible cases for how a price increase would affect quantity demanded and consequently total revenue. We have 3 different cases, one in which demand is price elastic, another in which demand is price unit elastic, and lastly, when demand is price inelastic. Suppose that in each of those cases, we have the same increase in price, say by 10%. In the first case, when demand is price elastic, that increase in price will lead to an even greater change in quantity demanded. So if prices rise by 10%, we might have a 15% reduction in quantity demanded. That given percentage rising P is more than offset by a larger percentage fall in Q, and consequently total revenue falls. When demand is price unit elastic, that given percentage rise in P is exactly offset by an equal percentage fall in Q. And in this case, total revenue does not change. They are completely balanced by one another. And lastly, if demand is price inelastic, as we just saw, that given percentage rise in P will cause a smaller percentage fall in Q, such that total revenue actually rises in this case, because now we're adding much more total revenue from the price increase than we're losing from the number of customers or units sold. Conversely, for a price cut, if demand is price elastic, we'll have many more customers coming in, and that will boost total revenue. If demand is price unit elastic, that price cut will be equally offset by an increase in consumption, and there's no change in total revenue. And then lastly, if demand is price inelastic, that price cut will only lead to a modest increase in quantity demanded. And in this case, because quantity demanded isn't rising all that much, total revenue actually falls because you're losing a lot of revenue from your existing customers due to that price decrease. So let's explore why this matters in a healthcare setting. Let's consider the price elasticity of demand for a prescription drug and how a price change will affect total patient expenditure. So in this analysis, we're going to suppose that there's no shift in the demand curve for a given prescription drug over time. And this is a simplifying assumption because in practice, the demand curve is shifting all the time. But we'll consider two different demand curves. One which is relatively less price elastic, as we'll see, it will be defined as being price inelastic, and one which is relatively more price elastic, and as we'll see, that's also going to be defined as price elastic. And so how will a price increase influence total patient expenditure and total revenue for the manufacturer in each case? Supposedly, we have the following downward sloping demand for a prescription drug. Those suppose that the price unit is $500, and then at that price, the quantity demanded, say per day, is 100 units. In that case, we'll have total expenditure of P times Q, or $50,000. So this is the amount that's going to be spent on this prescription drug by patients or their insurers. And this is also going to be a total revenue for the drug maker. Now, suppose the drug maker increases the price of this product from $500 to $600. We know that will reduce quantity demanded. That's going to be a movement upwards along the demand curve. And now at that price point of $600 per unit, we will have 90 units demanded per day from the part of the patient. That will lead to total expenditure of $54,000 and also total revenue of the same amount. So we can compare total expenditure before and after this price increase, and also total expenditure before and after the price increase, to examine this relationship between price, total expenditure, or total revenue, and the price elasticity of demand. When comparing those two areas, we see that we had total revenue before of P times Q, or $50,000, and total revenue now of $54,000. So the difference between the two is $4,000. And as we'll see, that is partly due to the fact that we're bringing in much more revenue from the price increase than we're losing in revenue from the reduction in quantity demanded. And that's very much due to the fact that demand between those 2 points on the demand curve is being defined as price inelastic. So let's calculate the price elasticity of demand between those 2 points exactly. And the most precise way to do this is to use what is called the midpoint method for calculating the price elasticity of demand. Here, that elasticity is going to be evaluated using the average of those 2 quantities, 190, and the average of those 2 prices, 500 and 600, to get a very precise measure of the price elasticity of demand. So now we're looking at the change in quantity demanded, the new quantity minus the old over the average of those 2, all over the new price minus the old over the average of those 2. For now, let's go back to the exercise and take a look at how we can use this formula to calculate the price elasticity of demand between those 2 points on the demand curve. We noted that because of that price increase, total revenue and total expenditure are rising. So we have additional expenditure of $100 per unit for the 90 patients who continue to buy this prescription drug. That's adding $9,000 in total revenue or total expenditure on this drug. We also have reduced expenditure by $5,000 because now there are 10 patients who are no longer buying that prescription drug at $500 per unit because of that price increase. In this case, the change in total revenue for the total revenue minus the old total revenue is $4,000. And that's principally due to the fact that we're seeing an increase in expenditure or revenue coming from the price hike that is offsetting the reduction in unit sales or quantity demanded. Now, between those 2 points, if we use the new quantity of 90 minus the old quantity of 100 and divide that by the average quantity of 95 and divide all of that by the new price of 600 minus the old price of 500 over the average price of 550, which is the midpoint there. That would give us a price elasticity of minus 0.58, which is an absolute value less than 1, which means that demand between these 2 points is price inelastic. So that's why the increase in price led to increased revenue and also increased expenditure on the part of patients who were their insurer or their insurers. Now contrast that with the case where demand is more price elastic. We'll suppose that consumers have many options for this prescription drug. Maybe a generic version of that drug has been made available. So now that the same price increase from $500 to $600 might lead to much greater responsiveness on the part of the patients or their insurers, such that the quantity demanded falls from 100 to 50 units per day. Now we still have that same total revenue from before of $500,000 at that price point as shown in the blue shaded area. But now at this much higher price point of $600. Consumers are cutting back considerably, as you can see in the purple shaded area. And so we have an increased expenditure on this drug due to the price increase. 50 patients or their insurers are now paying $100 more per unit. That's $5,000 and an increased expenditure. And so we have increased expenditure on this drug due to the price increase. So 50 patients or their insurers are now paying $100 more per unit. That's $5,000 in increased expenditure. but now we have a substantial reduction in quantity demanded by 50 units per day, and those were consumers who were previously paying $500 per unit. And that leads to reduced expenditure of $25,000 from the reduced unit sales. So in this case, the reduced expenditure from the reduction in quantity demanded more than offsets the increased expenditure from the price hike, and total revenue on net is falling by $20,000 because of that price increase. And this is principally because demand between those 2 points on this new demand curve is price elastic. If we use those figures for quantity and price, we would see that the price elasticity demand in absolute value is much better than 1, and that's therefore price elastic between those 2 points. We get some practice with these relationships between price, total revenue, or total expenditure, and the price elasticity demand. Let's go through the following exercise, and please feel free to pause this video at any point, and you might want to grab a notebook or a few pieces of paper and pencil to go through this exercise during this lecture. Suppose you're an analyst for a pharmaceutical company. The company is considering whether it should raise the price of its drug from $10 per unit to $14 per unit. Given the law of demand, you expect the quantity demanded to decline from 50 million units to 46 million units because of this price increase. Based on the above figures, what is the price elasticity of demand in absolute value for this drug? Make your calculation using the midpoint method. And how would this price increase affect total revenue or total expenditure on the part of the patients or their insurers? Remember that the midpoint method we're looking at, the change in quantity demanded is Q1 minus Q0 over the average of those two quantities, all over the change in price P1 minus P0 over those averages of prices. Let's suppose that Q0 is 50 million and Q1 is 46 million. Then the average quantity will be 96 divided by 2, or 48 million. It looks like the initial price, PO, would be $10, but the new price, P1, would be $14, and the average of those two, 24 divided by 2, would be 12. So given those figures, if we use the midpoint method for that calculation, we would have the change in quantity demanded of 4 million, that's a reduction of 4 million, over the average of those two quantities, 48 million, all over the change in price. It's a $4 price hike relative to the average of those two prices, would be $12, and that would work out to a minus 1/4 or a minus 0.25. And in absolute value, that is less than 1, meaning that demand between these 2 points on the demand curve is price inelastic. Because demand is price inelastic, that increase in price will lead to an increase in total revenue or total expenditure on this drug. Specifically, because of this price increase, the pharmaceutical company sees reduced revenue from the reduction in quantity demanded, which was 4 million units, and those were 4 million customers previously paying $10 per unit, and that's a reduction of $40 million in revenue. At the same time, this company sees increased revenue from the higher price charged, so for the 46 million customers to continue to buy this product, they're not paying $4 more each for that product, and that leads to an increased revenue from the price increase of 184 million. This implies that total revenue would increase by 144 million because of that pricing increase, and this is the same as saying that total expenditure on that drug increases as well. And we can see this differently by noting that total revenue before was P times Q of $10 per unit multiplied by 50 million units, or 500 million, and the total revenue 1 is the new price multiplied by the now lower quantity demanded. That was $14 per unit multiplied by 46 million units, or 644 million in total. So the change in total revenue, or change in total expenditure, is the new total revenue minus the old. That's an increase of $144 million. This has important implications for the healthcare sector. So we have demand is price inelastic, as it is for many healthcare goods and services. An increase in price leads to an increase in total spending on the part of patients or their insurers, as well as an increase in total revenue for the manufacturer. Conversely, if demand can be made to be more price elastic, perhaps by encouraging more competition or the entry of generic versions of the same products in that case, an increase in price would actually lead to a decrease in total spending on the part of patients and their insurers, as well as a decrease in total revenue for the manufacturer. So to the extent which demand is price inelastic, it has significant implications for how price increases ultimately affect healthcare spending in this country. As noted in the Burnell text, the demand for health services has been consistently found to be price inelastic. And we should note that the price elasticity of demand differs by service type. So hospital admissions is considered one of the least price-sensitive healthcare services. Consumers don't have many options whenever they are being admitted to the hospital in terms of the prices they pay. Emergency department use for less urgent care is fairly price sensitive, and mental health care is very price sensitive. With regard to pharmaceutical demand, Burnell notes that individuals are fairly price sensitive concerning pharmaceuticals, and in particular, higher copayments reduce overall drug spending. There was a paper that was recently published about the effects of increases in cost-sharing requirements for Medicare patients and how those increases in out-of-pocket prices resulted in reduced drug consumption and increases in mortality. If you'd like to read more about this paper, there's a short write-up from Vox included in this week's module. And that concludes this PowerPoint presentation.